Hi everyone, welcome to my video blog for seminar. I decided to research Parkinson's disease, and the article I selected is titled Effects of Vestibular Rehabilitation on Fatigue and Activities of Daily Living in People with Parkinson's Disease, a pilot randomized controlled trial study. Parkinson's disease is a degenerative disease that affects the neurosystem. It is broadly classified as a movement disorder. People living with Parkinson's will experience instability, rigidity, they'll experience bradykinesia, as well as impaired reflexes and dysfunction to their balance system. Now, when you live with Parkinson's, a lot of patients have reported they have a very high fear of falling. And this fear of falling can really limit their activities of daily living. They decide to take smaller steps, hold their body a little tighter, and this lack of movement creates a negative feedback cycle that affects their muscles, their strength, as well as their cardiovascular system. I really enjoyed reading this article because it didn't just focus on the physical effects of what the vestibular rehabilitation was trying to do, but it measured their fatigue and their activities of daily living. And I thought that was a really insightful way to measure their results. So often as therapists, we focus on exactly what the body is doing. But their perception of what's happening to them can be very important when helping our clients achieve the greatest outcome. So this research that I read, it took two groups of 12 people living with Parkinson's disease and divided them into two programs. So they were randomly selected, volunteers, and they were randomly placed in these two programs through just blind envelopes. Now, there were some exclusion criteria, but the main inclusion criteria was they just had to have Parkinson's. So the two groups of 12 were two groups of people living with Parkinson's, either through stage 1 to stage 4. Now, the case group did the actual vestibular rehabilitation, and the control group did warm-up, basic stretches, torso rotation, as well as patient education. They performed these programs 3 times a week for 60 minutes, and the program lasted for 8 weeks. Now, before the intervention started, they did a pre-test. Now, the person administering the pre-test was blinded to the interventions, and the pre-test was 3 questionnaires. The questionnaires were the Parkinson's Fatigue Scale, Modified Fatigue Impact Scale, Functional, and the Functional Independence Measure. At the end of the 8 weeks, the participants retook the 3 questionnaires, and the results were overwhelming. The individuals that participated in the vestibular rehabilitation scored much higher in the activities of daily living, as well as experienced reduced fatigue. I think a big strength of this program is its cost effectiveness, not to mention the fact that it really did show great results across the board. Vestibular rehabilitation really is comprised of 3 main categories. Now, the first 2 are going to be head and neck movements, one in a static position, the next in a dynamic position, which is typically walking, and then the third is going to be oculomotor exercises. Oculomotor exercises can be looking back and forth quickly between 2 fingers or 2 items, or fixing your gaze on something as you move your neck. So as you can see, those oculomotor exercises can be done anywhere, which is a huge strength of this program. One neat thing I want to mention is the article actually says oculomotor exercises may play an important role in neuromuscular reorganization, as oculomotor pathways are thought to be impaired in Parkinson's disease, which is reflected in worsened postural control. So these exercises might improve the coordination of the head, torso, and pelvic girdle movement during walking and help to maintain the postural stability. I mean, this is a huge implication because these exercises are super cost effective and can be done anywhere. I read other studies that show that virtual reality can be held on and used to improve the balance of people living with Parkinson's, but that's not always going to be very cost effective. We're not going to tell our clients to go buy a $300 Oculus and then I'll set them up on a home balance program. But these oculomotor exercises paired with that other vestibular rehabilitation, like I said, can be easily taught in a clinic, and then the participants can do them at home. And these simple exercises reduce the fatigue of all the participants involved, as well as improve the activities of daily living, which is a huge strength to this research. One of the limitations was the small sample size. I think the 12 and 12 maybe wasn't enough to create a general representation of what is possible. I would have liked to see in the future a bigger sample size, as well as maybe different groups based on the stage of Parkinson's each participant was in. In addition, I think a longer study now can be used. Instead of just the 8 weeks, we can do a follow-up program to see if these exercises can be maintained at home. We can do a longer program to see if that reduced fatigue can last, if these exercises really do help the perception that the patient is living with to reduce that fear of falling. And so if we can come up with more long-term results, I think that would be fantastic with anyone living with Parkinson's. Well, I really enjoyed reading this article because I do think it was really important to address not just the physical aspect of therapy, but also the mental aspect and what our patients experience. So I hope you guys enjoyed this mini presentation. I think everyone's working really hard. You guys continue to work hard. It's such a fun program to be in and experience with all you guys. Remember, keep learning, because the more we learn, the more we can help.